My name is Dr. David Benversi, and let me share with you how our spinal decompression therapy can help eliminate and reduce disc herniation, and in effect, a lot of times reduce the unnecessary need of unnecessary surgery for that disc herniation. So let's first talk about a little bit about what the disc herniation or disc bulge is. When we have the disc, which is basically between two bones, that disc acts almost as like a cushion. Now when we typically have a disc bulge or a disc herniation, there's pressure that's being applied unevenly and more or less causes one area of that disc to protrude out or push out from where it would typically be sitting or situated. Now when that disc pushes out or bulges out, there's a couple things that it typically does. One thing it can do is it will sometimes push into the spinal cord or the spinal canal itself, causing a lot of problems, or it could also push into the spinal nerves themselves. Now some of the typical symptoms that we see with that is we'll have pain, we'll have numbness and tingling going out into possibly the arms or even the legs, and also a weakness in the muscles in both the arms and hands and also the legs and feet, if depending on the situation or the location of that disc bulge or disc herniation. Now that we know a little bit about what it is, let's talk a little bit about our therapy and what that actually does. Now when we have our spinal decompression therapy, we basically have a table where you would lay face down and we would secure your legs, and we also would secure your upper body. And what that table does is it more or less distracts or pulls those bones apart a little bit, and also opens that disc space up. So effectively it allows that disc to replace itself or go back to where it was supposed to be and take a lot of that pressure and essentially decompress the area. So if you've had a disc bulge or you think you're suffering from a disc bulge or a disc herniation, give our office a call. We'd love to help. Call us at 618-519-9334. My name is Dr. David Benversi, and let me share with you the effects of our decompression therapy on disc herniation and the associated leg pain, particularly the burning, stinging, numbness and tingling, and sometimes even weakness that is associated with the legs. Now let's first talk a little bit about how the disc herniation or disc bulge actually occurred or happened. Now between each set of bones in your back there's a disc, and basically that disc is supposed to be able to take and some of the shock or absorb some of the pressure that goes through those areas. And when we are doing things repetitively over long periods of time, sometimes those disc, if the pressure isn't applied evenly over those discs, will have a weak point where that area might push out, or that disc will more or less bulge out in that particular area. Now that bulging out can a lot of times cause a couple different things. The first thing it will help, or what it'll cause, is it'll bulge and push into the spinal nerves or the spinal canal. The second thing that it will do, or could do, is push into the spinal nerves, and that's what we typically see when we're having the leg pain, the burning, the numbness and tingling, and also the weakness, is that bulging out is pushing actually into that spinal nerve itself. Now, the way that we correct that, or what we do to help fix that, is we basically have a table that we have set up that you are more or less laying face down or flat on this table, and we will secure your legs and also your upper part of your body. And this table does two very specific things. What it does is it basically helps pull or distract those two bones, and the bone above and the bone below that disc, so it increases that disc space so that it has basically a negative pressure, so that disc is going to naturally want to go back to its normal position. The second thing that table does, it actually flexes that lower part of the table ever so slightly, and what that does is it increases or accentuates that therapeutic effect even more, so effectively reducing that disc bulge or disc herniation very effectively. So if you think you're experiencing or suffering from a disc bulge or a disc herniation, give our office a call. We'd love to help. Give us a call at 618-519-9334. My name is Dr. David Benversi. I'd like to share with you the effects or the effectiveness of our spinal decompression therapy in reducing a disc bulge or disc herniation with regards to pain. Now, there's three main things that we're looking at as far as that can cause pain or pain generators when we're referring to a disc bulge or disc herniation. The first one is the disc actually itself. The fibers or the outer wrapping of that disc has a lot of nerve endings or pain sensitive in those areas, and if that area is being pushed or herniated out, that sensitivity is going to increase, and we're going to have pain associated with that disc bulging. The second thing we're going to have problems with is when that disc actually bulges out. A lot of times it'll push into the spinal canal where we're going to have our spinal nerves. Now, that in itself can cause pain in that area, but a lot of times we'll also see pain that will go down into the legs. We'll have numbness and tingling going on into the legs, and we'll also, even at some severe cases, have a weakness in those muscles down in the legs and feet as well. The last pain generator that we're going to be talking about is the joints themselves. So when that disc decreases in space or is basically bulging out in a particular area, what that does is it causes increased pressure on the joints on the bones above and below that disc. Now, in between those joints, they're basically called facet joints. The space in between those joints are very highly innervated, so they're very sensitive to pressure. So with that increased pressure, we're going to have increased pain in that area. So now that we've explained a little bit about the pain generators, let's talk about the therapy itself. With the therapy itself, what we do is we will strap you to a table, or we have you laying flat on a table, and we'll secure the lower part of your body and also the upper part of your body. And what that table will do is it's going to help decrease or distract those two bones away from each other. So the first thing it'll do is it's going to help reposition that disc bulge or disc herniation back to where it needs to be. So it's going to effectively eliminate the pain associated with that disc bulge or those fibers on the disc itself. The second thing that it'll do if we reduce that disc bulge is that disc bulge is not going to be pressing in on those spinal nerves anymore, thus effectively reducing the amount of pain and symptoms that we're experiencing down into those legs. And lastly, what that therapy will do is it's going to basically have that decompression, or it's going to take that pressure off of those joints that we had in our back. Again, those facet joints, when they're being pressed or compressed on, that sensitivity or the pain generated from that is going to be effectively reduced with that distraction. And in addition to the distraction on that table, the table also ever so slightly flexes down, which enhances the therapeutic effect of our decompression therapy. So if you think you're experiencing the pain or symptoms associated with a disc bulge or a disc herniation, we'd love to help. Give our office a call at 618-519-9334. My name is Dr. David Benversi, and let me share with you how our spinal decompression therapy can help eliminate a disc herniation or a disc bulge and essentially help you reduce your chances of having surgery in that area. Now, first off, let me tell you a little bit about the surgical consult or the surgery itself. In some situations, surgery is necessary and an effective treatment for what you might be experiencing. However, we're going to talk a little bit about first the mechanisms of how that disc herniation or disc bulge gets there, and then the final steps before we would need to essentially consult a surgeon to do that. So typically, as far as our disc bulge or disc herniation, we have discs which are in between each set of bones in our back. Now, those discs are made to more or less absorb some of that pressure, the shock absorber between those two bones. Now, if that pressure is not applied evenly over that entire disc, sometimes those discs will give out in certain areas and basically become a disc bulge or a disc herniation. Now, when that becomes important is when those disc bulge or disc herniations start to encroach on that spinal canal, which is where our spinal nerves are being housed or where they're going through at that point. Now, as far as some of the symptoms we would experience with this is we're going to probably have some pain or discomfort in that area. We'll possibly have pain or discomfort going down into the legs. We'll have numbness and tingling in the legs. And we can even have, in severe cases, a decrease in the muscle strength and control of those muscles in the leg. Now, typically when we talk about surgery, the main thing that we are trying to help or treat with that surgery is neurological deficits. And what I mean by that is typically when it gets to a point where we don't have any, or we no longer have control of bowel or bladder function, or sometimes in the severe stages of those symptoms going down the leg, that's when we're going to have that severe neurological deficit. And those are normally confirmed or backed up by studies that are basically your nerve conduction velocity test and also your electromyograph, which is basically going to measure the impedance of that nerve or the signal of that nerve and how strong that is going through that area. So that's basically the reason or the time frame of when surgery is necessary. Now, there is also a time frame before we get to that point that is very essential, and that's what we can help out with as far as avoiding that surgery. Now, just because you have the symptoms as far as the pain, the numbness and tingling and burning going down into the legs, that's not necessarily a prerequisite for the surgery. At that point, we are typically still something that can help you out as far as eliminating that disc herniation. Now, let me tell you a little bit about how our therapy works and how that eliminates that disc herniation. In our therapy table, basically what we have you do is laying flat on a table, and we secure the lower part of your body and the upper part of your body, and what the table does, it basically helps distract or pull those two bones apart that we were talking about before, above and below that disc, and effectively creates a negative pressure in that disc. So that disc is going to want to sort of suck back or go back to where it was supposed to be or where it originally was. And in addition to that table more or less pulling those bones apart, it's also going to slightly flex the lower part of your body, thus enhancing the therapeutic effect of creating more of a negative pressure and causing even more of the disc wanting to go back to its normal shape or normal condition. So in those situations, we can effectively reduce the disc herniations and disc bulges, and we can also help you out with those symptoms we were talking about before, as far as the leg pain, the leg numbness and tingling, and sometimes even the neurological effects as far as the decrease in the muscle strength and the coordination in those muscles as well. So if you think you're experiencing a disc bulge or a disc herniation, we'd love to help. Give our office a call at 618-519-9334.